that infectious thing is in the patient's overall underlying health. So some of your infections could be something like pneumonia, flu, bronchitis, croup, tuberculosis, SARS, and then there's your upper respiratory things like colds, pharyngitis, epiglottitis, and other things like that. Now there are some specifically that are more prevalent in pediatrics, and we'll talk more about those when we talk about pediatric populations. Our overall goal for these patients with respiratory infections is to ensure an open airway, adequate breathing and oxygenation, and of course protection for ourselves. So tuberculosis at one point was one of the leading causes of death in the U.S. And it is unfortunately starting to make somewhat of a comeback in the U.S., which is kind of concerning. TB is often spread through the respiratory route, and it's going to manifest as a respiratory disease, but it can affect a lot of different parts of the body. TB does occur at higher rates among patients with HIV and AIDS due to that immunocompromise there. With tuberculosis, it usually is going to require close, repeated contact, so it's more prevalent in places where people are together in close areas for long periods of time, like jail, nursing homes, homeless shelters, things like that. It can be treated with antibiotics, but there are a lot of drug-resistant strains. In all honesty, a single occupational exposure, like on an ambulance, is not likely to result in disease, but it could. So it's really important that you wear an N95 respirator in any case of a known or suspected active pulmonary tuberculosis case. If you have never been fitted for an N95 or put one on, you should. You need to. You need to make sure you can get a good seal. If you've got a big bushy beard and that N95 won't rest up close to get snug against your skin, it's not really protecting you as well as it should be. And of course, we need our routine testing according to whatever the employer's policy is. Typically, you'll get a TB skin test about once a year. Now, your active TB has a presentation similar to other infectious respiratory diseases like fever, chills, night sweats, fatigue, chronic cough. Hemochrapus can also be present, which is just coughing up of blood, so that should increase your suspicion specifically of tuberculosis. Now, pneumonia is a kind of a catch-all name. There's a lot of different things that can cause pneumonia: viruses, fungus, bacteria, things like that. A lot of these strains of bacteria are part of the community-acquired and hospital-acquired pneumonias. And pneumonia can affect anybody, but the risk is greater in smokers, elderly, people with chronic illnesses, and immunocompromised patients. I've had pneumonia one time in my life. I was in my early 20s. I did smoke at the time. I don't anymore. I worked in a casino-type situation where there was a lot of smoke. The ventilation was not that great. And a month into working there, I got pneumonia. And it was probably the worst I have ever felt in my entire life. Like, I thought I was going to die for real. And my chest hurt from coughing so much. I couldn't breathe. I couldn't get comfortable. My entire body ached. It was terrible. I would not wish it on just about anybody. Your typical signs and symptoms: sudden onset of high fever with chills, difficulty breathing, pleuritic chest pain, and cough. And that cough may be productive or non-productive. And the sputum, it may be white, it may be kind of clear, it may be greenish. It just depends on how the pneumonia is affecting you. An important note as far as fever goes is that elderly populations may not have a fever, so don't let absence of a fever, especially in an elderly patient, rule this out for you. With pneumonia, the body's response is to produce this purulent material in the lungs, and you're hopefully going to cough it up. Usually pneumonia is localized to one area, like one lobe of one lung, which is going to have localized crackles and wheezing from that fluid being produced and inflammation of the lung tissue. Occasionally, though, you may have pneumonia in more than one lobe or even bilateral lungs. So, in severe cases, this oxygen saturation can be greatly reduced because of that fluid and inflammatory response in the alveoli. So we want to carefully assess the patient's airway, their work, and their quality of the breathing. Great breathing quality, right? And their oxygenation. We want to provide oxygen as needed. We want to assist ventilations as needed. We may want to consider some beta-2 agonist if we suspect that pneumonia is causing is the cause of that wheezing. We may want to consider IV fluids. Fever, increased respiration, decreased oral intake can all lead to dehydration. But we can't fix the underlying cause. They need to be probably antibiotics if it's bacterial, sometime in the hospital. Now, influenza, colds, pharyngitis, bronchitis, these are all kind of lumped together. But the common cold in and of itself, we just get like the sniffles and you feel like crap for a couple of days, is a lot of different rhinoviruses and coronaviruses, and there are millions upon millions of different types of virus, and there's probably more out there we haven't found yet. But they're going to affect your upper airway, and this is going to give you your nasal congestion, your runny nose, your sneezing. Now, the fun thing is that this is all the things that our body, like our response to the problem, so it's our body's immune system that's giving us these conditions, trying to get rid of that virus. Now, you can have some complications, including like sinusitis or ear infections. Ear infections suck. You can have acute bronchitis. That's just inflammation of a bronchi, and that's usually from one of those viral infections. You ever had a cold and then like you're toughing it out and then it moves into your chest and then you're like, oh, yeah, time to go to the doctor now. That can happen. Now, RSV, or respiratory syncytial virus, is another one that's fairly common in the pediatric populations. You don't typically see it in adults, but they tend to be seasonal. Like most viruses, they're more predominant in the winter, it seems like, but they can happen at any time. Bronchitis can be bacterial, but not as commonly as viral. For your acute bronchitis, it can also be caused by inhalation or aspiration of some kind of irritant. Anything that can irritate those bronchi can cause it. Your bronchitis usually is going to start with a dry cough that's going to become productive, and the onset's over a few days, usually within a few days of those cold symptoms. So, you got the cold symptoms, you're toughing it out, a couple days later, bam, it's in your chest, now you've got the full-on bronchitis. Usually it will resolve itself spontaneously in about 2 to 3 weeks, which is why that cough lasts forever, it seems like. But, it can be more complicated in patients who have underlying respiratory diseases or immunocompromised. If in doubt, check with your doctor. Not necessarily the ER, but your doctor. Now, pharyngitis is just inflammation of the pharynx, and this is commonly known as a sore throat. Once again, can be caused by a lot of the viruses that causes your colds and the respiratory things like that. Also can be caused by something simple as like a postnasal drip. So there's a lot of stuff here that can cause it. Probably one of the more severe versions is streptococcal bacteria, and this is strep throat. All right, so most sore throats are going to resolve on their own, but in the cases of the more severe ones, like your strep throat, you need to be very careful because some of these cases can result in glomerulonephritis, which can actually put you in acute kidney failure. Can lead to untreated, can lead to rheumatic fever, and even rheumatic heart disease. Strep throat's usually accompanied by fever, maybe some swollen cervical lymph nodes, and some kind of exudate, which is just fluid and like stuff on the tonsils itself. Now, with your peritonsillar abscess, this is going to be caused by bacterial infection in a capsule around the tonsil. And with this, it's not super common, but you can have some pretty substantial pharyngeal edema, and that could potentially lead to an airway compromise. So patients do need to be evaluated further. Now, your flu or influenza is going to be an infection from one of the dozens and dozens and dozens of influenza viruses throughout the airborne route. Typically, your flu viruses are highly contagious, and some have a significant mortality rate, and it's weird because some of them, kids and old people are at the most risk, and then other ones, it seems like it's more, has a higher mortality rate in the overall average age adults that are normally healthy, like 30s to 40s. It all just depends on that particular strain of virus. But usually you're going to have a sudden onset of fever, oftentimes with those body aches and chills, sore throat, muscle aches, headache, cough, weakness, fatigue, and they can lead to dehydration, pneumonia, and encephalitis. And a lot of times when you hear somebody got sick with the flu and died, they actually acquired pneumonia as a side effect of the flu. Now, as far as flu vaccines, they decide every year what are the most likely strains, what they expect the most likely and prevalent strains to be in the United States every year. And so at the start of flu season, usually around September, these vaccines are developed and released. They are recommended for all individuals who don't have a contraindication. It's really important if you work in the healthcare field and you are able to get a flu vaccine, it's going to give you your best protection. So go ahead and get the flu shot if you can. Now, there are some people who can't, and that's okay. There are potential side effects. for the flu, but just be aware that is your best protection against getting the flu. Now, the reason we have to get a new flu shot every year is because these viruses tend to mutate, so the vaccines from the previous years don't always necessarily give you protection in subsequent years. Just like other viruses or other vaccines, the flu vaccine does not cause an illness. It uses an attenuated or weakened virus which cannot give you the virus. All right. Some people may have some mild symptoms of generalized illness shortly after receiving the vaccine. This is the normal response of the immune system, not an infection with the flu virus. All right. And those people that do get the actual flu after vaccine, this is because they got exposed to the virus shortly after or before the vaccine. Now, I will say from personal experience with my son, he got the flu shot, and last year he got both flu A and flu B. One in the fall, one in the spring. But both times I was kind of like, does he really have the flu? Even though they tested him at the doctor's office, he had one day of feeling bad, and then after that he's like, can I play my games on the computer? Can I get on Xbox? He still couldn't go to school, but he felt a whole lot better than, and I've had the flu one time in my life when I was in college, and it was rough. And so if you do get the vaccine and you still do somehow get the flu, your odds of having a less severe version go up pretty substantially. Now, some other respiratory syndromes. You've got SARS, all right, so coronavirus, and it causes acute pneumonia-like illness. Hadn't been really reported since an outbreak in 2004, but it did have a very high morbidity and mortality rate, so that, you know, they still do surveillance on this with the CDC. Now, more recently, they have a similar coronavirus that called an illness called the Middle Eastern Respiratory Syndrome, or MERS, because it seemed to have originated in the Middle East. With this, if you ever are around a patient who you suspect has some sort of viral respiratory syndrome outbreak, like SARS or the MERS, you need to wear your proper N95 respiratory protection. And protect your eyes as well, because you don't want somebody coughing in your mucous membranes. That's just gross. Now, pertussis, not as common as it used to be, but it is still around some, and it's a serious, sometimes fatal disease, and it causes coughing fits that can last for 10 or more weeks. That's a long time to be coughing. A lot of times patients will be gasping for air after the coughing fit, and this has that whooping sound. Now, they don't recommend the Tdap, which is your diphtheria, tetanus, and pertussis vaccine until 2 months of age, and then it has a series of 5 vaccines to give immunity. So this makes your newborns and infants very vulnerable to infection. So sometimes with our pertussis vaccines or booster shots, it's not so much for our benefit as the patients that we'll be coming in contact with that are pediatric, so we don't transmit the pertussis virus to them. So with your infectious diseases, you know, where they are, how they present, things like that, it varies. It varies based on time, what season it is, and where it's located. With some of these respiratory illnesses, recent travel can be very important, especially if there's an unknown cause of illness or any potential contact with somebody who's been traveling. So remain up to date on your seasonal outbreaks and diseases that are in your area and any suspected epidemics. Generally, cough, stridor, drooling, sore throat, nasal congestion, adventitious lung sounds, which just means funky, otherwise not normal, all indications of some sort of respiratory infection. We want to make sure that we assess for hypoxia. We ensure an adequate airway, breathing, and ventilation. And being prone to dehydration, consider some IV fluids, and of course, proper PPE.